The total number of COVID-19 cases reported from the Minuwangoda cluster currently stand at 1,397. From this figure, 121 infections were reported last night, out of which 87 are factory employees who were quarantined, while the remaining 34 are close contacts of the factory employees. In addition, 90 more COVID-19 patients were confirmed today. Out of these, 40 were factory employees identified at quarantine centres, while the remaining 50 are their close contacts. In the meantime, 3 doctors at the outpatients department of the Kegalle hospital have tested positive for the virus. Out of the 3 doctors, 2 are residents of Mavanella, while the other is a resident of Kegalle. The doctors were identified after officials at the hospital conducted PCR tests on hospital staff following the admission of a Minuwangoda factory employee to the hospital on the 30th of September. Meanwhile, the son and husband of one of the doctors residing in Mavanella have tested positive for the virus. The husband of the doctor has been identified as a manager employed at the Ceylon Petroleum Storage Terminal facility in Kolonnava. In other developments, Regional Director of Health Services in Kegalle, Dr. Kumara Vikramasinghe, stated that 19 out of the 247 close contacts of the Minuwangoda factory quarantined at the Brandix factory in Pinnawala have tested positive for the virus. Meanwhile, 12 people at the Lanka Electricity Company's Customer Service Centre in Kandana have also tested positive. It was revealed that a group of employees from this office had attended a wedding in Divulapitiya on the 1st of October, where employees of the Minuwangoda garment factory had been present. It was also revealed that a daughter of one of the LECO employees was an employee of the Minuwangoda garment factory. After PCR tests confirmed that the father and daughter were COVID-19 positive, all other LECO employees had been subjected to PCR tests at a private hospital. After PCR tests confirmed that the father and the daughter were COVID-19 positive, all other LECO employees had been subjected to PCR tests at a private hospital.
එතනදී 12 දෙනෙකු පොසිටිව් වෙලා ඒ අනුව අපි සේවකයන් රෝහල්ගත කිරීමටත් ඊට අදාළ සියලුම ආශ්‍රිතයින් නිරෝධායනය කර ආරක්ෂා කිරීම සඳහා මේ වෙනකොට කටයුතු කරමින් පවතිනවා.
Meanwhile, Seeduwa Administrative Public Health Inspector Suresh Kumar stated that 45 cases have been reported from the Katunayaka, Seeduwa, Raddolugama and Adiyambalama areas that fall under the Seeduwa Health Medical Officers Division. Most of them have been identified as employees of the Katunayaka Free Trade Zone. Among these new cases is a grade 2 teacher at a school in the Adiyambalama area.
ගුරුතුමියකටත් රෝගේ වැළඳිලා තිනවා. දැනට මූලාශ්‍රයක් සොයා ගැනීමට අපහසු වෙලා තිනවා. පොදු ප්‍රවාහන සේවා තමයි පාවිච්චි කරලා තින්නේ ගුරුතුමිය. රද්දලුගම ප්‍රදේශයේ දේවගතිවරයෙකුට කොරෝනා රෝගය ආසාදනය වෙලා තිනවා. දැනට මේ දේවස්ථානයට පැමිණි 20කට අධික ප්‍රමාණයක් නිරෝධායනය කිරීමට කටයුතු යොදමින් පවතිනවා.
Elsewhere, 2 employees of a private company in Makola Kiribadgoda have also tested positive for the virus yesterday. Health officials stated that one of the employees was a brother of a Minuwangoda garment factory worker. As a result of this, 32 of their close associates were directed to undergo self-quarantine. Meanwhile, one of the 2 associates of the Sri Jayawardhanpura University student who tested positive following an initial PCR test conducted earlier has tested negative after a second PCR test. Further, authorities have also subjected the aunt of one of the patients to a PCR test after it was revealed that she was employed at the Minuwangoda garment factory. In another development, the father of a student at the University of Ruhuna has tested positive for the virus. Following this revelation, the student along with another student who shared accommodation at a hospital in Dondra have both been quarantined. In the meantime, a staff member of the National Development Bank branch of Marine Drive has been diagnosed as a COVID-19 patient. Releasing a statement, the bank said that the branch will be temporarily closed until further notice. Meanwhile, a Sri Lankan Airlines Cargo Operations Division employee had also tested positive for the virus. The employee is a resident of the Gampaha area and had been admitted to the hospital, while 50 of the patient's colleagues have been subjected to PCR tests.
ලංකාව ලෝක සෞඛ්‍ය සංවිධානයේ පැසසුමට ලක් වෙන විදිහට රෝගය සමාජගත වීම පාලනය කරගෙන ඉතාමත් හොඳින් පහුගිය කාලය වෙනකම්ම කටයුතු කරා. තවමත් අපි මේ අපේ ලංකාවේ කොවිඩ් ආසාදනය හොඳින් කළමනාකරණය කරගැනීමේ හැකියාව තියෙන මට්ටමේම තියෙනවා. දවස්වල පැතිරෙන වෛරස් ප්‍රභේදයේ විරුලන්ස් එක වැඩි කියලා. විරුලන්ස් එක වැඩි කියන්නේ තා ලිහිසියෙන් කෙනෙකුට බෝ වෙන්න පුළුවන්. ඇන්ටිබොඩි හැදුනහම වෛරස් ලෝඩ් එක අඩු වෙන්න පුළුවන්. එහෙම අවස්ථාවක ඊයේ දවසේ පොසිටිව් වෙලා අද දවසේ නෙගටිව් වෙන්නත් පුළුවන්. මේක ලෝකෙත් එහෙම වෙලා තියෙනවා. නමුත් ඒ පුද්ගලයා සමාජයට මුදා හරිනව නෙවෙයි. ඔහු ගෙදරදී නිරෝධායනයට හරි යොමු කරලා නැවතත් PCR පරීක්ෂණ කරලා තමයි ඒ පුද්ගලයාව සමාජයට මුදා හරින්න අනුමත කරන්නේ සෞඛ්‍ය අමාත්‍යාංශය විසින්. දැන් චීන කාන්තාව යවන්න ඉස්සෙල්ලත් අපි පරීක්ෂණ දෙකක් කරලා ඒ දෙකම නෙගටිව් වුණාට පස්සේ තමයි ඒ කාන්තාව රිලීස් කරේ.
In the meantime, the Pattitotam and Periyakadai areas in Mannar that were placed under isolation have been reopened as of 6 p.m. today.
ලීව ආයුෂ් කරාබු නැටි දන්තාලේපය ශක්තිමත් දත් දෙපළකට